Welcome everyone to this European Public Health Week. I'm happy to see so many of you here. Today's webinar will be about the new approaches to tackling drug driving, lessons from the UK. And it is hosted by the Global Law Enforcement and Public Health Association and the Police Foundation from the UK. My name is Andrea Badake, and I'm the Vice President of the European Public Health Association, the section on law and public health. Drug impairment driving is an escalating public health challenge across Europe, and it's sitting at the crossroads between road safety, substance use, policing, and prevention. Over the next hour, we'll hear from frontline police practitioners, behavioral scientists, and campaign specialists about what actually works. At the end, we'll have a question and answer session, and please use the chat to submit your questions throughout the session, and if possible, also to the person to whom you're addressing the question, because that will make it easier at the end to be able to answer all of your questions. I will collect them, and I will ask the panel at the end. So now let me introduce our first speaker, which is Ruth Halcon, and she is the one who brought this session together and will also open and setting the scene. She will also introduce the next speaker. So please now let's introduce. Please now, Ruth, go ahead and start your presentation. Thank you.
Thank you so much, Andrea. So, as you said, my name is Ruth Halcon. I'm a research manager at the Police Foundation. And the Police Foundation is a UK-based research-led think tank, and our job is to improve policing for the benefit of the public. And so as part of our research, we've come to realise that drug driving is a growing problem. In the UK, in particular, between 2014 and 2023, there was a 70% increase in driver fatalities where drugs were present, and young men are particularly at risk, with a majority of drivers impaired by drugs and collisions being male, and 4 in 10 between the ages of 17 and 29. And so there is a problem here, and it's the scale where it's a public health issue, not just a criminal justice issue. And so I've brought together 3 amazing speakers who are, in their own way, are doing their bit to tackle drug driving and to change people's mindsets, so they're more likely to think before they get behind the wheel after taking drugs. And so first, we've got Frank Malin. He's a drink, drug, drive liaison officer for Nottinghamshire Police, and he's also the chair of the team which produces the drunk, drug, drive investigation forms for police in England and Wales. So he's a retired police officer with many years' experience at PC sergeant and inspector level, and he's going to talk you through what the problem looks like in the UK and how the police are attacking drug driving as an enforcement issue and some of the limitations of that enforcement. Thank you, Frank.
Right, can you hear me? Good. Okay. Right. The UK, there are 3 separate legal jurisdictions. England and Wales is one, Scotland another, and Northern Ireland another. The legislation is much the same throughout. Road Traffic Act 1988 is in Great Britain, and Northern Ireland has got similar legislation. Next slide, please. That's obviously the issue, that the legislation is there is to try and prevent folk doing this. And of course, that one is a combination of alcohol and drugs, which is a really, really risky factor. The offending driver was killed in that collision. Next slide, please. Okay, so we have 2 main offences in the UK. What we call the unfit offence, which goes back all the way to 1930 with some slight amendments over the years. It covers driving or attempting to drive or being in charge. It's gone. Of a mechanically propelled vehicle on a road or other public place, so it's not just roads, whilst unfit to drive through drink or drugs. And the definition of being unfit is your ability to drive is impaired. It's somewhat subjective. The police have to convince a court that the person's ability was impaired when they were driving, so there's lots of arguments around that one. Okay, next slide, please. Okay, the next offence, which came in 2015. So until 2015, that was the only drug drive offence that existed. It's what we now call excess specified drugs. It doesn't apply to Northern Ireland. It's only England and Wales and Scotland. Northern Ireland only has the unfit offence. This is limited to motor vehicles, so a slightly narrower category, but it is road public place. And simply, if you have in your body one of the specified controlled drugs, and there's a couple of regulations which list 17 drugs, and the proportion in your blood or urine exceeds the specified limit for that drug, you commit the offence. So impairment is not a requirement of this offence, which makes it much easier for the prosecution. Next slide, please. Okay, it is a strict liability if over you commit the offence. All the drugs listed in the regulations are controlled drugs. They've set them in two separate bands. The completely unlawful drugs is a zero tolerance approach from the government, and they've set the limit just above accidental exposure claim. So you can't claim you're in a car with your mates and they're all smoking. That's how you got it in the system. The other 50% of the drugs in the regulations, they're lawful on prescription, and they're set at a much higher level above normal medical use. So you're obviously abusing the drug, and at that level, they're quite likely to be impaired. Next slide, please. This just runs through the drugs in the regulation. These are what classed as the unlawful ones. They speak for themselves in the limits in micrograms per litre. Okay, next slide, please. These are lawful on prescription, so the threshold is much higher, as are these. Okay, next one, please. These are the penalties. If you're driving or attempting to drive and commit either an unfit offence or excess drugs, and it's actually the same for excess alcohol, it's a mandatory minimum 12 months disqualification. You will lose your licence for 12 months. It does carry a maximum of 6 months imprisonment. In reality, you have to be a repeat offender to go to prison or in extremely high levels, and as a fine. If you commit a second drink and or drug drive offence within 10 years whilst driving or attempting to drive, it's a minimum 3 years disqualification. You can get a little bit knocked off your disqualification if the court offers you a rehabilitation course, which they do in most cases, but they don't have to. Okay, next one, please. Okay, if you commit it by being in charge, so there's no driving or attempting to drive, it's a discretionary disqualification, maximum of only 3 months imprisonment, fine. And if you're not disqualified, you receive 10 points. And if you collect 12 within 3 years, then you are disqualified. Most first-time offenders tend to get 10 points and are not disqualified. Okay, next slide, please. Okay, the testing that police can do at the roadside for drugs, there's obviously a breath test for alcohol, is an in-field impairment test. You have to be trained and authorised to do that, so there's a limited number of officers who can do that. And then there's a preliminary drugs test using a bit of type-approved equipment. We don't have random testing for anything in the UK for drugs. Preliminary testing can only be required from a driver if they've been involved in a collision, they've committed a moving traffic offence, or the officer suspects a drug in the body. It's a low bar, suspecting a drug in the body, but you do have to have that suspicion. Next one. Okay, that's the first type-approved device, the Draeger 5000. It's has very limited use these days in the UK. And the next slide will show you the one that is used by most officers, most police forces, is the drug wipe 3S. Only tests for 2 drugs, cannabis and cocaine. Next slide, please. That's just a picture of a double positive for cannabis and cocaine. Okay, next in, please. Although the offence says excess drugs in the blood or urine, it is only they've only set limits in those regulations for the 17 drugs in blood, so it becomes a blood-only offence in reality. Scientists said they couldn't set meaningful limits for urine for those drugs. If you have a positive preliminary drugs test, an officer can then require a specimen of blood or urine. Next one, please. Oh, there we go. If they don't have a positive preliminary drugs test, but they're still suspecting drugs, before an officer can make a requirement for blood or urine, they have to have a doctor or healthcare professional assess the driver. It will be done in custody, and they have to say they have a condition which might be due to some drug. Once that's been said, then the officer can require a specimen. So having a positive preliminary drug wipe is a much more streamlined process. There are some issues, of course. Each preliminary drug test costs about £17, which is much more than doing a breath test for alcohol. And there are availability issues because of the cost and the distribution. They only test for cannabis and cocaine. If a subject can't provide blood, there is no excess drugs offence. You can go to urine to prove the presence of a drug for the unfit offence. Of course, there are no limits set for the unfit offence. But there are problems with, obviously, some drug users have collapsed veins and we just cannot get one. There is lab capacity issues, certainly when it first, the offence first came in 2015. The lab struggled to cover the volume of blood specimen being submitted, and it is much more expensive than testing for alcohol. Next slide, please. Yeah, there was a bit of a concern that some officers, they have a negative preliminary drug test, will say, they're not a drug driver, it's negative, when of course all it is, they're negative for cannabis and cocaine. And officers don't always investigate the unfit offence. They just think, I've got a positive drug wipe, that's good enough. But of course, sometimes it may come back under the limit. The specimen may contain other drugs which are not in the regulation. So if you've got unfitness, you can then charge an unfit offence. Latest problem we're having, it's not that widespread, but is increasing, and there is concern over it, is medical cannabis and the medical defence for an excess drugs offence. Next slide, please. So it is a defence only to the excess drugs offence. That if you are taking the prescribed drugs in accordance with the prescription, you do not commit the offence. Doesn't stop you being prosecuted for unfit, but a lot of excess drugs drivers, they're on the illegal drugs and it's a low bar and impairment's not always present. The issue with cannabis is, of course, in 2015, when the excess drugs offence came in, it was classed as unlawful drug, so it's got a low limit, 2 micrograms. But in 2018, the government authorised medical cannabis to be prescribed, but we're still running with the low limit. So it does mean people on the prescription can be taking the medical cannabis and will be over the limit. Next slide, please. And it's quite a difficult one for the prosecution to disprove the claim, and it is on the prosecution to disclude the medical defence claim beyond all reasonable doubt. Okay, next slide, please. Conviction rate for the unfit offence stands around 78%. These are the figures for England and Wales. As you can see, there were just over 1,000 convictions in 2014 for the unfit offence, which was all that existed then. 10 years later, with 9 years of the excess specified drugs offence, we've had 24,000 convictions for drug drive. So it's gone from 1,000 to 24,000. Just to show you there, that drink, of course, is still a big problem, nearly double the number of convictions for drink drive. So drink, of course, is still a real problem. And that's it, basically. That's a quick run through the situation in the UK. As I say, Northern Ireland only has the unfit offence. There is talk of introducing excess drugs, but it hasn't come in yet. Okay, thank you.
Thank you so much, Frank, and thank you for giving us that whistle-stop tour of why this is a thing we all should be aware of and we all should take notice of. and also for showing us some of the issues facing enforcement and some of the successes as well. So next up, we've got Michaela Green. Michaela is the behavioural science lead at Claremont, which is a behaviour change communications agency. And she's been working with Sussex Police on a campaign to reduce the number of people being killed or seriously injured over the festive period. And this response to this problem of increased drug driving was the Think Again campaign, designed to stop people in their tracks and to prompt that moment of doubt before they get behind the wheel. So Michaela will talk through that campaign, her work with Sussex Police, and she'll put the wider idea of behavioural change and promoting behavioural change in context. Thank you, Michaela.
Thank you, Ruth. I'm going to try very optimistically to share the screen. No, of course, that's not really worked. Give me 1 second. This is why we did a test, and it did work in the test. That's quite unfortunate, isn't it? Okay, can you see that? Okay, I'll just share that in.
If you click, there we are.
Yeah, is that okay? Excellent. I'll assume that's fine. Hi, everyone. Thank you very much for joining. I've got 15 very whizzy minutes to talk to you about the psychology of drug driving and what we know based on the research that we've done at Claremont and the wider literature that exists, particularly in the UK. So sometimes when I start this presentation, I ask the audience, when you picture a drug driver, who do you imagine? So I'll give you sort of 20 seconds to imagine a drug driver on your patch or in your area. And normally, people imagine somebody like this. Is that a stereotype? Well, if you looked at the data in the UK, if you looked at convictions, self-reports, etc., it's not a stereotype. So statistically in the UK, a typical drug driver is male. Sorry, men, 90% or more, sometimes 93% of drug drivers are male, often aged early 20s to early 30s, normally driving a normal passenger car, often driving kind of late in the evening or at night on a weekend, Friday, Saturday, Sunday, most likely using cannabis or cocaine, although, as Frank alluded to there, I think that's massively swayed by what we can test for roadside. So what do we not have good evidence for nationally in the UK? Well, we don't have good evidence for ethnicity. That's not kind of collected centrally or nationally. We don't have good evidence for social class in its relation to this topic either. And across Europe, this is pretty similar. We're talking about males primarily. We're talking about young adults and night detection as well. Cannabis being the most common drug on record across Europe in drug driving offences, although, again, suspect massively swayed by what can be tested for. This also comes up a lot. Are drug drivers more likely to be drink drivers? This comes up all the time, and it's quite complicated. There's reasonably strong evidence that drug drivers are more likely than average to also drink drive, but this relationship is sort of mostly about overlap in risky driving behavior. So it's not necessarily simultaneous drink driving and drug driving. And we did some work with Sussex Police in England, as Ruth mentioned, which I'll show you briefly later. And locally, there was actually a very small overlap between those who tested positive in a drug wipe roadside who also tested positive for drink driving. It was something like 6% of those tested, so really low proportion. And the Think team, Max obviously on the call is speaking next, have done some really good research on this. And last year, they found that almost a third of young men thought that it was okay to drive after taking drugs as long as you felt okay. But 3/4 of these same men said that they would never drive after drinking. So this is quite a complicated topic. I think it's safe to assume that most drug drivers are not simultaneously drunk. Personally, I would not couple them up in one campaign for many reasons. And I alluded to this by mentioning the Think research, but this is actually a very common belief in UK surveys, especially, particularly among younger people, this idea that drug driving isn't as bad as drink driving. I think drug impairment can feel subtler for a lot of people. Drink driving obviously also has had decades of public campaigning in the UK and across Europe, whereas, drug driving has had much less visibility. And I've conducted qualitative research with drug drivers, A number of them have told me, cannabis actually makes me a better driver. And that kind of brings me to our first sort of psychological insight, which is very pithy, which is I'll be fine. Most drug drivers are very overconfident. They like to downplay risk. And the literature tells us this, and the work we've done directly with drug drivers tells us this as well. Drug drivers kind of have a perceived invulnerability or overconfidence regarding their driving skills. A lot of drug drivers think that they drive better than average, even when they're not consuming drugs. And this kind of allows them to recalibrate drug driving as being actually not that risky. And there was a really good PACS report in the UK, and it kind of said that young people are more likely to assume that drugs do not impair their driving. And there's what we'd sort of call a reinforcing loop at play in the brain here. So every time a person drug drives and there's no consequence, it just makes them believe that they're safe and competent and they were right to have made that decision. And there's a few kind of cognitive biases, behavioral biases that we think are quite relevant that we've heard in a lot of our research. The first, what it sounds like, overconfidence bias. And we hear things like, I can handle it better than most people. I'm an above average driver. Optimism bias, again, what it sounds like, we hear things from drug drivers like bad luck doesn't really follow me. I'm not someone that gets unlucky. I tend to come out on the right side of things. Those are the kind of things that we hear in qualitative testing that speak to sort of overconfidence. Now, paradoxically, even though they sort of downplay risk, drug drivers that we've spoken to are actually very risky individuals. And we hear things like this: I can have a bit more, I can handle it. There's a lot of risk-taking in this group. Risk-taking personality traits are very strongly linked to drug driving. There was a big meta-review in the UK a few years ago, and it found that drug drivers score very high on measures like sensation-seeking and impulsivity and other things that you'd associate with risk. So risk-taking is sort of reinforced by a sense of getting away with it. And again, there's some feedback in the brain here, this leads to sort of a greater willingness to take future risks. I've got away with it once, I'll probably get away with it again. And we know that dopamine systems in the brain particularly active in early adulthood, and that makes this sort of thrill of getting away with it even more reinforcing. There's a few behavioral biases that often come up when we think about risk-taking and drug driving. One is risk compensation. This is when people feel confident in their ability, so they actually take greater risks because they really believe that they can manage those risks. We hear things like, I can have a bit more because I'm a good driver. We also hear illusion of control, which is the belief that someone can sort of control external outcomes that are largely influenced by chance, other drivers on the road, weather conditions, for example. And we hear things like, I'll just drive carefully, it's fine. So there's no regard for external factors that might influence the safety of their driving. And then confirmation bias, this idea that nothing happened last time, did it? So again, why would anything happen this time? And both of these things are sort of risk-taking and the overconfidence, they tie together neatly into this belief that drug drivers have that they will never actually be caught. And I'll show you on screen here a few verbatims from some qualitative research we did with roads policing officers in the UK. And they agreed, drug drivers look at the number of police out and about where they are. They look at their history of getting away with it, their friends' history of getting away with it, and they think, I'm just never going to be caught. It's so unlikely. And I don't have time to go through all of these. I'm happy to pick up with anyone separately, but just a few more kind of key insights that have come out of some of our work with drug drivers. One is that drug drivers often miscalibrate the next day risk. They really do seem to think that any amount of sleep resets the clock. And sometimes we'll hear rationalizations like, well, I had to get to work, so what was I supposed to do? I think the type of drug is very important. We see that cannabis impaired drivers often feel more cautious, more capable than they actually are. Drivers on cocaine, a stimulant, as you'd expect, they exhibit recklessness, overconfidence. The drugs are consumed obviously in different spaces and places with different people, and that makes a real difference to communications that you put out. And this idea that everybody does it, I think, is very important. The police force we work with were really nervous that they were actually going to normalize drug driving by putting this campaign out there in the world. You're really not at great risk of doing this. I think young people in particular really do think that drug driving is a very normal and common occurrence, if anything, surpassing drink driving now. So in terms of what might work, I'm going to share, as Ruth mentioned, very briefly, some work that we did with Sussex Police in England last Christmas. I think addresses a number of these issues. The evaluation for this campaign was done internally by the police force, but can be shared separately if you like that. And we really landed on this idea that drug drivers don't see risk. They think that nobody gets caught, and they think that it's not going to be me. And our strategy in both the creative, which I'll show you, and in the media buy was to sort of myth bust and amplify perceptions of enforcement, so really increasing awareness of this issue, and to use local and relatable scenarios to disrupt kind of this overconfidence, this desensitization to the problem. So really increasing relevance as well. So awareness and relevance are really key measures for us in this work. And here's one of the 8 executions on screen. So I'll just read this to you. The police don't do drug driving stops around here. Jamie, 22, from Brighton, which is in Sussex, stopped on a night out, banned from driving for 12 months and had to sell his car. Think you won't get caught, think again, which is really the sort of strapline for the campaign. So you can see that we're kind of amplifying perceptions of enforcement using local and relatable scenarios throughout. This is quite a formulaic approach that we used across a lot of this work. And you can see a few more on screen here. And these really were things we heard in the qualitative testing. The police don't do drug driving stops around here. The police only test for drug driving in the towns. Dan, 26, from Midhurst, stopped on the way back from his mate's house, banned from driving for 16 months and lost his job. So very tangible consequences, which I'll come back to. You'll probably get away with drug driving around here. We heard that a lot. And I'm sure smoking cannabis makes me a better driver. And then a few more on screen here. The police aren't stopping drug drivers over Christmas. It's very important that we made this feel timely, as it was a Christmas campaign. A little bit of coke at a party won't affect my driving. Last night's drugs won't affect my driving now I've slept. And even if I've used drugs, I know when I'm okay to drive. The force really wanted to have a few executions so they could target drivers the next morning, because that was, especially Monday morning, very important in terms of who they were managing to pull over. So why does this work? I think as a concept, it's quite easy. This concept allows us to sort of myth bust without getting into those finer biological details about how long drugs stay in your system. It's very difficult to run a campaign in that regard. You obviously don't know what people have taken. People themselves don't know what they've taken most of the time. Each execution really quickly points to this being about drugs and driving. I think this is attractive in a sense because the concept has local relevance. Each execution used sort of this intriguing visual of a drug driver in a handcuffed stance. In some of the executions, the backgrounds are a lot more apparent, and they were local backgrounds around Sussex. It's quite a social campaign. It uses in-group voices. The audience are really hearing from people like themselves. And I think it's quite timely. So we had a lot of supporting copy around this work, which relayed what actions the police were taking this year at night and in the mornings. So it didn't feel just like a rerun of something. It felt like something fresh and new. And if anyone is joined from the policing sector in the UK, we'll be sharing this in more detail at Outcom next week. I think it's Monday afternoon. So hope to see some people there as well. So what should you do? I think some people on this call will be here because drug driving is a problem in your area, in your country, or you think it's a growing problem, and you need a solution that maybe comms could deliver. So if I had a fresh sheet of paper, here are some of the things that I might do. Firstly, I think it's really important to look at the local data. So maybe some of the things that are evidenced in the UK or nationally where you are will be quite different in the area that you're looking at, the specific area where you live. So I think that's really important. Sometimes that can involve the police painstakingly going through each case file to assemble that data, but I think it really is worth it. And secondly, I would conduct research with drug drivers in your area and not just sort of transpose work from somewhere else. I think sometimes there are very specific local insights, locations, events that you can miss by doing that. I think once you've done the research, maybe you can use something that exists already. Maybe you'll need to create something new, but that will become obvious. Thirdly, I think focusing on the immediate risks, and we didn't have time to really get into this today, but I think if you want to bring up consequences, not just scaring people, we know that fear in isolation kind of does not contribute to long-term behavior change. So we think a lot about tangible consequences, and this really came out in the qualitative research we did as well. But things like lack of freedom, losing a license, losing your job. These are implications that people feel could really affect them and would also affect them immediately if they got stopped. So I think it's really important to focus on those tangible things. And then finally, increasing perceptions of enforcement. So you probably cannot dramatically increase the police presence where you are, but there are lots of clever ways that you can increase the perception that police are everywhere. And that might be in the creative, that might be in the media. In other police campaigns we've done, we've used sort of roaming ad vans. So these are kind of vans that display the messaging that are constantly moving throughout the area. So you've just got this perception that this is a big issue. You're spending a lot of money on it, whether that be in media or enforcement, and that you're likely to get caught. I think that's really important. So that's all I've got today, and I apologize. I know it was very quick. So I'll hand back over. Here are my details if anyone wants to chat wherever you are in the world. And you can also find me on LinkedIn as well. And I'll stop sharing, Ruth. Hopefully that's worked, and come back to you.
Yes, it has. Thank you so much, Michaela. Thank you so much for that whistle-stop tour of drug driving, and also showing a really innovative approach which has the idea of making an issue, making people aware of it, making sure that it applies to them. And I think I heard you had some really good results in raising awareness and reducing the drink driving. And yeah, we'll, if Michaela's happy, we'll share her email address in the chat. So next up, last but not least, we've got Max Malagoni, and he's a marketing team lead at the UK government's Department for Transport, and he's responsible for driving the long-running Think Road Safety campaign. And so we're going to focus on the first Think campaign in 10 years to focus on drug driving. Don't put drugs in the driving seat. So this again was aimed at young men, almost actually represented in drug driving road collisions. And the key message, the challenge was the idea that if you feel fine after taking drugs, you're safe to drive. So it highlights that drugs can stay in your system for a long time, kind of pay your judgment, and kind of consequences that are lifelong. Great. Thank you, Max. Are you able to share?
Yes. Let me attempt.
Max, sorry, you're. Can you hear me? You're muted.
Yes. Sorry about that. Let me try again. Okay. Okay. Great. Cool. Can all hear me? Good.
Yep.
So sorry, I'll start again. Just to say, it's very good to follow Michaela, because a lot of what I'll talk to will be similar insights, similar strategic thinking. As Ruth explained, Think is a national campaign, and it's a long-running road safety marketing campaign that's been very successful in the UK over the years. Drug driving is not something that we've run a campaign on for, I think, over 10 years. The last one was when the law changed in 2015. So this was a really good opportunity to tackle, obviously, what is a growing problem. I won't linger on these. We've talked a bit about, obviously, the scale of it increasing in recent years. What I will just call out here is a lot of what we look at from a data perspective is the road casualty data, especially casualties that are killed or seriously injured, or KSIs. And as you can see, the percentage of fatal collisions where there has been a driver where drugs has been detected, that kind of orange line where drugs are a factor has been steadily going up, kind of drawing ever nearer to where we see drink driving. And obviously, as we've talked, there are sort of increases and improvements year on year in the scale of testing and the ability with which the police are able to actually to find drug drivers in the first place, and also lab testing that can then be matched to casualty data. But I think it's also been alluded to in the chat. We do think this has long been an underreported problem. So, you know, the data here is probably still just a fragment of what is likely happening out on the roads. As been mentioned before, with Think, we particularly focus on young male drivers. In this instance, when you look at the data for drug driving collisions, 90% are male, 4 in 10 in that under 30 bracket. So we definitely know that young males are the predominant group that we want to focus on. Again, Michaela's touched upon this, so I won't go on about it too much, but we know from a lot of campaigns we run this optimism bias, this barrier to reaching young drivers, because a lot of them think that they are, you know, unlikely to be involved in a collision. On the left, we have polling data that we regularly run. As you can see, the orange bar is the young male cohort, and they're significantly less likely, or more likely, the way you look at it, to consider that they're a good driver, that they're better than the average driver, and that their chances of being in a crash are low compared to the general population. And this is very much corroborated by some of the verbatims that we get when we run focus groups. We know they're comfortable with taking calculated risks, and their perception is they think they're going to be all right when they do, so the risk is worth taking. With drug driving specifically, we've run a number of more detailed focus groups on this, very much echoing what Michaela was saying. One of the main perceptions is this idea that they feel fine to drive. As mentioned before, 32% in a recent study we did saying they think it's okay to drive after taking drugs, if they feel fine to do so. Whereas with drink, there is a much more established and long-running association with that impairing your driving ability. Whereas with drugs, what we see is that people think, well, actually, they affect me, you know, in a different way. I'm actually not impaired. As Michaela said as well, some of them think they're actually better drivers. So we know there's definitely a perception challenge around the actual impairment effect of drugs on their driving. So there's an initial challenge with getting across the fact that even if you don't think you're impaired, the drugs are in your system and they're having an effect long after you think those effects have worn off. Another thing which obviously we've already alluded to is this common acceptability of it, especially amongst this peer group. A lot of the young men we spoke to said they know their friends who do it, or they know at least someone who does it. And in a way, it's not called out as socially unacceptable. It's not seen as much of a risky behaviour as perhaps drink driving is. So for our campaigns, and similar to Michaela, we do break down a challenge into what the levers for behaviour change are and how we can apply behaviour change frameworks to our communications to try and find the best way to nudge people's behaviour into healthier outcomes. In this instance, we've applied the COMBI model for behaviour change, which breaks down, you know, a challenge into what the capability, motivation and opportunity levers are to get someone to change their behavior. In this instance, with the capability, which is around the knowledge, the skills, the actual ability of the person to do the behavior in the first place, what we wanted to do with our campaign is really demonstrate exactly how drugs can impair their driving, but also be quite stark about what those consequences are, be they punitive, be they social or physical. So putting that on people's radar. By doing so, that in turn affects their motivation, their will, or their belief that they should engage in the behavior. So by showing these consequences, we want them to reconsider the risk they're taking, the likelihood of being caught, the likelihood of having a criminal record. And lastly, the opportunity, which is sort of the environmental factors, the time, the capacity that they live through that make the behavior possible. Through running this campaign, which we hope to do so over a number of years, we want to see a new norm established whereby drug driving is more socially unacceptable, that friends do call out their friends who are doing it, that they do suggest positive alternatives. And And in laddering all those up, the goal is to obviously change the eventual behaviour and have a situation where young men actively choose not to drug drive because they know the risks and they know the consequences they face if they do so. So taking these insights, these behaviour change kind of ideologies, we've worked on a campaign which very much puts the driver in the driving seat, shows the consequences in the driving seat. And this led us to our proposition about don't put drugs in the driving seat. What we've done with the creative is try and show like how one small choice can lead to a spiral of consequences. And as we've heard before, being tangible with those consequences has a real impact. When we tested this with our audience, we knew that the consequences were key. A lot of young men told us that they need to be challenged on their behaviour. They need to see the real outcomes of their choices. And actually, you know, the laddering of showing how a small choice can lead to something like being caught by the police, being stopped by the police, potentially then losing a license, up to the more serious, that did resonate, especially the more serious, which is where obviously would be the worst case scenario to be involved in a collision or to be in a situation where you had killed or harmed someone else. But they almost needed to be taken there on the journey to start putting this on onto the same level that they look at drink driving. What we also found from a creative point of view is that we do need to adopt a serious tone with this. Something campaigns in the past, we have used humour, and humour can be effective. Humour can get you noticed. But for this subject, a lot of people felt this is quite serious. Actually, we haven't spoken about it for quite a while. So we do need to take a serious tone. And another important aspect is to appeal to their autonomy. We know that driving is a real expression of freedom for a young man, for a young driver in particular, their sense of control. So piercing that and showing how that can be at risk was another insight that has led us to this creative. And a couple of verbatims here about, you know, that small choice leading to big consequences also corroborated the approach we took. So I'm going to try and show you our hero film, but to do this, I'm just going to reshare. You bear with me.
Good to drive? I am now, mate.
Later, guys. I've seen it once. Look at your eyes.
Back to the front.
Look into this.
I'll get you a cup of tea in a minute.
We try. Oh no. Look at your eyes.
Right. Sorry, hopefully that worked. I had to come out and reshare, but might have been a bit jittery. I think the buffering can sometimes make it a bit stop-start, but hopefully it gave you a flavour of how we try to bring, you know, that subject to life and in a creatively impactful way. And like I said, the spiralling of consequences is something we know really does resonate with this young audience, and actually showing how one moment can lead to many other more negative ones. On screen here are some other examples of how we brought the campaign to life and some of the outdoor advertising, again sort of showing the parallels between in the moment and the consequence, and also alluding to other aspects, other consequences that can play out, such as, you know, having a criminal record, which could risk your future, which could risk your future employability, as well as, you know, the more direct ones of actually seeing some prison time. Just a small point on targeting. So with a campaign like this, we obviously look at multiple different ways we can reach the audience. I won't go on for too much longer because I want to show you a bit on the results, but just to say that with this one, we worked quite closely with the sort of data we could get from the police, from a national level, in terms of where there are more active drug stops and arrests. We looked at census data to highlight parts of the country where there are more young people who have a driving license. Obviously, social media gave us scale. Young men in particular are very kind of present on the likes of TikTok, Instagram. So we made sure we kind of dialed up the presence we have on those platforms. But other interesting tactics that we tried out on this campaign were trying to tap into the points of a young person's evening where they might be engaging in drug taking and then going on to drive. So we looked at trends amongst young people with sort of playlists they listen to before they go on a night out, as well as night in playlists they might have as well, and sort of targeting adverts around those playlists. We looked at contextual placements, so when people are going out of a weekend, of a Friday night, looking at getting messages in front of them, for example, at cash points where they might be taking out cash to pay for drugs, as it's still very much an inherently cash business. We looked at takeaway stores, convenience stores, again, thinking about that late night snacking or munchies moment, to target people along the path of when they might be then thinking about going home. And also another important part for us across all of our campaigns is using third-party voices. So we do work a lot with influencers and content creators, sports podcasts, to put the message out there in a voice and in a tone that we know the young audience relate to. So just to finish, I'm just going to share some of the results from the campaign. So first thing I wanted to just say is, being a marketer myself, I probably would say this, but creative cut through is incredibly important. This is a really saturated media landscape for young people in particular. Being a government campaign, we're up against brands that spend 5 times as much to try and get eyeballs on their product. So being noticed is the main part of the challenge to start with. But what we did see with this is having quite a direct and impactful route did stick in people's minds. We actually saw it being one of the better recognized think campaigns compared to our recent drink driving campaigns. And actually having 72% of the audience recognize the campaign is a very positive result compared to the benchmark we normally have by campaigns of this size. Got some very good verbatims and commentary from people who really did take the storytelling aspect out of the creative, and saying that it did sort of make them stop and think. And then just onto some more kind of in-depth survey data that we've got on that audience. The positives here are seeing some shifts in those getting the message that a criminal record is a likely consequence if they drive after taking drugs. That went up following the campaign. Also, what was interesting is we had a subset sample of people who did admit to taking drugs and also driving. And we asked that group of people in particular how likely they'd be to drive after seeing this campaign. We saw a slight increase there. And whilst that is a self-reported group, there's positive indications that maybe that consequence message is cutting through to those particularly at-risk drivers. And down the bottom, what we saw overall was a 5% increase in drivers saying they changed something to do with their driving as a result of seeing this campaign. And examples of that could be, I knew I was going out where drink and drugs could be a factor, so I chose not to drive, or I chose to get public transport. So actually making active decisions to not put themselves in a situation where they might be driving. I'm conscious of time, so I'm just going to finish off. The last point again is obviously in terms of tactics and voices and who we work with to try and get the message out there, as well as running main advertising campaigns. We do work with content creators and influencers a lot. That gives us a good opportunity to talk about these subjects in a longer form, to delve into some of the particulars about drug driving a bit further. So some pieces we've done recently, this one on the left was with a group of presenters who work for a social media channel called Joe, talking about what mates can do to step in and advise their mates to take different decisions if they've been out drinking and or drug taking before they drive. And the one on the right was about explaining the science, so very much trying to get under the skin of how drugs impair your driving, what you need to watch out for, and why, if you know anyone who is taking a range of drugs, what that looks like, so that they don't fall into the trap of then thinking they're okay to drive as a result. And I think that is the end of my presentation. I'm sorry I've not put an email address on here, but I'm be more than happy to share it in the chat. But yes, I'll stop there.
Great, thank you so much, Max, and thank you for showing how having the right message in the right way, address the right audience, really does change attitudes and does make a difference. So I think it's lessons for us all in other parts of policing as well about how we can have that communication piece and how we can make people realise that actually their actions do have consequences. So now we've got a bit of time for a chat. I'm going to try and allow people to talk. So we have more of a general session. I'll see if that works. Great. So can people if that's worked or not? In the meantime, I could just go to the chat and see if there are any questions.
I think it works now. It shows that talking is permitted, but I think you just did it manually, not for everyone, possibly. Oh yeah,
Okay.
now it's getting more people are getting permission.
Great.
There
So
are
while
some-
I'm doing that, does anyone have any questions they'd like to ask?
I think there were some comments from Jason, and maybe he would like to talk about it. He was the first one who.
Yeah, I'm very happy. Very happy to speak.
Great, excellent, Jason.
So it's just in relation to, well, there were a couple of points actually. So firstly, the terms of scale of the issues facing the UK around drug driving, and I think it's fair to say, I think hopefully colleagues that's been presenting would support this. The numbers that are recorded are significantly under to what actually is taking place, and some of the evidence base around that is some of the data we're seeing from workplace testing. So again, certain parts of the country at the minute are an organisation have a duty, a legal duty to test in the workplace, particularly for those in the haulage companies, etc. But some of the scale of illegal drugs, prescription drugs, and ultimately at the same time chronic alcohol use in some areas is 1 in 2 people are testing to levels that would be seen to be impaired if they were driving on the road. So certainly one of the issues, and again highlighted today, is that the scale is a lot greater than actually is reported, and I mean it's very much measured by law enforcement, which we know has got a part to play, but is limited in terms of capacity and capability. The other one is the polyuse one, so just linked into the Michaela presentation. I think it's great we're sharing some current data from Sussex, but I know from the role that I do supporting the Association of Police and Crime Commissioners lead for drugs, we've been doing some work, again funded by DFT, around the polyuse. So 5 police forces in the UK during the Christmas period were given additional funding to do both drug and alcohol testing on individuals stopped, and as anticipated, 25% were seen to be testing positive for both, when traditionally law enforcement would just do the one test, and particularly if it's alcohol, and if there's no suspect of drugs, then obviously that person would have to go on the way. So again, it's highlighting again, if we can't have that capability to do dual testing, the reality is there's individuals continue to drive on the roads whilst likely to be impaired and over the limits. The challenge as always is what more do we need to do? And again, linked into my first point, I think there's some other tactics that we could be doing more of, linked to the workplace, where actually both in terms of behaviour change, we can make a bigger difference than just relying on law enforcement.
Great, excellent, thank you, Jason. Does anyone have anything to come back to that one?
I think that's really interesting. I'd love to see that work, Jason. That's why we intentionally, I suppose, tested positive drug wipes for drink driving rather than the other way around.
Yeah.
But equally, I think even 25%, I was much lower than I was expecting. I mean, we thought there'd be a much higher overlap. I appreciate that there's lots of problems with the testing. I think from a communications perspective, I still wouldn't couple them up in one execution. I think, drink driving has a lot of high public awareness and social norms around it, and there's a risk people would think, oh, this is just another drink driving campaign.
Yeah.
So I could completely see why, although they might be higher than reported, I still wouldn't link them in one. I mean, I suppose in one strategic overarching campaign as think team done, but not in one execution.
Yeah, thank you.
And thank you, Jason. I think Kylie, you had a question as well. Kylie Baines, are you able to talk?
Yeah, I was just typing a reply out to her.
Hopefully, can you all hear me?
Yes, we can.
Oh, wonderful. Hi, greetings from Australia. I just wanted to check with Frank, the first speaker, what I thought I was hearing, that roadside drug testing in the UK only tests for cocaine and cannabis. And then a couple of follow-up questions about whether this is the case right throughout the country in North Ireland, and essentially why that is, and whether it's the limitations of the testing devices and what you have access to on the market.
Yeah, they in the UK they have to go through quite a stringent type approval process, despite them having been no doubt tested in many other jurisdictions and countries, and they've only gone through for cannabis or THC and cocaine.
Wow. Mm-hmm.
And I suspect, I might be wrong, I might be talking out of turn, but there's not an enormous incentive for them to go through an extremely expensive and lengthy process to add more drugs on. There is some pressure from the police service to add more drugs, but we're where we are at the minute. I'm sure it will happen eventually, but it's a slow process. You know, we're sort of almost 11 years in now with them, and nothing has changed. So it is a bit of an issue, and of course they're not that cheap to use, which can be budgetary issues as well.
Okay, thank you.
Thank you very much, Frank. We've got a minute or so left, so everyone should be free to talk. Are there any last-minute questions before we finish? Just speak up if you've got one.
I was just wondering whether there was any publicly available data that separates drink driving and drug driving, and whether that's broken down into illicit and illegal drugs and prescribed drugs.
Well, I just tried to put some links in. Sorry, I realised I popped them in and then no one could see them. But the Department for Transport has obviously the official road casualty data. They have broken that down into a couple of fact sheets and particular studies, which may be of use as a place to start. So I've popped one in there, which is the latest fact sheet, and I'll just pop the other one in, which does actually separate out. It has some kind of indications for type of drug as well, because there is a lag in the reporting on both drink and drugs. The data is always kind of 2 years behind where we get the official road statistics, but these would be the most, I would say, the most relevant sort of latest data from the Department for Transport.
Great, thank you.
And of course, the police are required to report on drink driving breath tests to the Home Office, but there's no requirement at the minute to report drug driving tests. So the data is somewhat lacking on the drug side.
Great, thank you.
Great. Well, I think that's now our time. So thank you so much, everyone, for attending and for your really good questions. Thank you, Andrea, for your presenting. Thank you, Frank, Max, and Michaela. And hopefully we'll see you at another webinar soon. And I'll share my email address in the chat, and you also got the panelists email us any questions. Don't hesitate to come back to us. And thanks again.
Thank you, everyone, for a great.
Thanks. Bye.
Thank you. Bye.
Bye.